Today, we'll take a look at autism and the treatment of acupuncture. www.healthcmi.com. This was published February 12th, 2019. An article entitled Acupuncture for Autism Found Effective at healthcmi.com. Click on News, and you can take a look. Acupuncture is effective for the treatment of autism spectrum disorder, ASD, in a double-blind, randomized controlled trial. University of Hong Kong researchers reveal that electroacupuncture improves core functions in children with ASD, especially language comprehension and self-care ability. True acupuncture was compared with sham acupuncture, and only true acupuncture provided significant clinical outcomes. Based on the evidence, University of Hong Kong researchers conclude that acupuncture is a useful adjunctive therapy in early interventional programs for children with ASD. So this is for people who are already getting proper treatment and support. When adding acupuncture into that program of care, there are significant improvements, and the data points are covered here. What types of outcomes and improvements that can be expected are covered. For licensed acupuncturists, the actual acupuncture points used are covered and how they work for the patient. So it's a valuable article. The researchers note that since ASD, autism spectrum disorder, is a heterogeneous disorder with comorbidities, and there was a lack of a single assessment tool, it is difficult to test the efficacy of a particular therapy. So they did a broad spectrum of analysis and measurements to try to get as many assessment tools into the program as possible to get accurate results. And I feel they did a good job. They went into fairly deep detail into what people could expect. And they definitely found that what's interesting here is that there was a higher acceptance rate by the children than expected. So this is, I believe, children approximately ages 3 to 18 years tops into this program. So even the younger children could accept the short 4-week, 12 sessions of electroacupuncture, and it had a nice benefit for language comprehension and self-care ability. So that's very significant, something really to take a look at. So if someone really wants to up their game and enhance the quality of care for these children, this acupuncture protocol shows that it is effective and safe, and in some cases well tolerated. And this is a deeper issue. How many children with autism spectrum disorder are willing to lie down on a table for half an hour, let's say, and receive acupuncture? Some will, some won't. And that is up to the bedside manner and skill of the acupuncturist to provide a safe and comfortable environment wherein the children can have a good treatment. Keep in mind that although it's not covered in this particular piece of research, there are other ways to increase compliance. For example, only using the scalp acupuncture point so the children can be seated and walk around during the needle retention time. And with that sense of freedom, then they're much more likely to comply. Here they were using the body-style acupuncture in addition to scalp acupuncture. So Sushen Sung on the scalp was used, but then again, so was Shen Men, Heart 7, PC6, Neiguan. So these points are on the arms, for example, Liver 3 on the feet. And electroacupuncture was also applied. So they surprisingly were able to get pretty good compliance. So that's a very good thing. What happens is if the children start out with a little acupuncture, something very simple, maybe even just a few scalp points, and start to have that relaxation effect from acupuncture set in, then they can usually receive the treatment with no issue. But again, compliance is really one of the most important issues when applying acupuncture for children. Take a look at the article. Go to healthcmi.com, click on News, look for the article entitled Acupuncture for Autism Found Effective. What we'll find here is an adjunctive care that can help these children. Take a look. Thank you for listening. www.healthcmi.com.